I'll be taking you through the hip capsular CAR. This is a drill we're going to want to do on our side, whether we're on a bench or a bed. Having a little bit of support for the head and neck is really nice, and we'll get right into it. So we're going to be addressing the bottom leg here. And the nice thing is I have a little bit of space cut out here, but if I was on my bed, I would be shifted over towards the edge. And I'd want to make sure that I'm holding on just a little bit so I don't feel like I'm going to fall off. The bottom leg's going to come forward at approximately 90 degrees. If you have a pinchy hip, then we're going to let it stay below 90 degrees so we have this downward angle this way. That'll give you more access to range to stimulate the hip capsule, aka the hip joint. So I'm going to actively pull my leg down towards the ground. That'll stimulate this area of my hip, the bottom side. And then as I start to draw it up, nice and slow, breathing, that'll stimulate the backside rotators and also a little bit towards the inner thigh, the adductors. And I let it go down. I'm going to do this repetitively, nice and controlled, over and over again for the allotted time. It's important that we keep our core nice and stiff, or we can use the top hand right here to push down to give us a little more rigidity through the torso, because we're trying to really isolate the hip through this range of motion. And if you pay attention to my foot here, I'm trying my hardest to keep the foot neutral through the whole process, and the ankle, because as we go down, it's easy to want to cock the foot up, but we're really trying to focus on the hip. If it's too much strain on the knee, then we want to make sure that we're using a little less range of motion. You can always challenge it a little bit deeper, so I can bring it slightly above 90 degrees. But we're trying to avoid any pinching sensations here. This is where it's going to be pretty limited, because this is the most shortened position for that hip capsule.